Hello, everyone. I'm Carrie Thibodeau, the National Director of Programs and Public Policy at the Kidney Foundation of Canada. Welcome to today's webinar, Conservative Kidney Management, What You Need to Know. Before we begin our webinar today, it's important to recognize the Indigenous land that we're on. Inspired by the 94 recommended calls to action made by the Truth and Reconciliation Commission of Canada, land acknowledgements are a necessary first step toward honoring the original occupants of a place. They also help Canadians to recognize and respect Indigenous peoples' inherent kinship beliefs when it comes to the land, especially since those beliefs were restricted for so long. I acknowledge with gratitude and respect that I'm joining this meeting today from Newmarket, the traditional territory of the Haudenosaunee, the Wendat, and the Anishinaabe peoples. If you know the territory from which you're joining today, please feel free to share it with us in the chat. The Kidney Foundation of Canada would like to thank our sponsors for the 2024 webinar series, Accenture, Amgen, AstraZeneca, GSK, and Otsuka. Their ongoing support allows us to come together to have broader, bolder, and braver conversations. The information shared in today's webinar is current as of today, August 14th, 2024. The information shared in this webinar is general in nature, does not necessarily cover all circumstances, and isn't intended as medical advice. While we make every effort to be accurate, we recommend that you seek advice from your healthcare team for your individual situation. And now, it's my great pleasure to introduce you to registered nurses Ruth DeBoer and Jennifer Walmsley. Ruth has been a nurse for 37 years and has worked with kidney patients for the last 29 years. From 2008 to 2020, Ruth was the Advanced Care Planning Champion and lead in the Alberta Kidney Care South program. During that timeframe, she also worked extensively with patients choosing conservative care and helped in the case management and care of these individuals. Ruth was a key member in the development of a full-day workshop on end-of-life and conservative care for kidney patients that ran for over 6 years and was delivered to 700 staff members across Alberta. Ruth is an advocate for patients exploring their wishes and helping them to understand their options and be prepared for their healthcare journeys. Jennifer is a registered nurse at the Kidney Care Clinic in Calgary, Alberta, located within the Sheldon-Schumer Medical Center. This multidisciplinary outpatient clinic is committed to supporting kidney patients and their families with comprehensive care, education, and detailed monitoring. In her role, she focuses on working with conservative kidney patients, their families, and community partnerships such as family physicians, home care, and continuing care facilities. Jennifer's educational background includes a Bachelor of Nursing degree from Mount Royal University in Calgary, Alberta. Her professional experience spans both inpatient and hospital settings and outpatient clinic environments, equipping her with a broad range of skills and knowledge to support her patients. Over to you, Jennifer and Ruth.
So hi, my name is Jennifer, and this is Ruth, and together we're here to present on conservative kidney care. Like we've been introduced, so welcomely, thank you. We're both registered nurses at the Kidney Care Clinic in Calgary. And we're here to talk to you about conservative care and what that looks like from our clinic. So when we talk about our clinic, we talk about the multidisciplinary team. So we work with registered nurses, LPNs, of course, the kidney doctors, the nephrologists. We also work with registered dietitians and social workers. So when we talk about the clinic today in kidney health, we're really talking about the team as a whole as well. So yeah, okay. So our clinic is working with patients with chronic kidney disease, and we work with stage 4 and stage 5 kidney patients. And so I'd like to, just acknowledge that our patients can be having lower kidney functions than maybe some people that have joined us today. We'll go to the next slide. So the goals of today is to talk about conservative care in general, what that looks like at our clinic, and then hoping to give some information and resources about decision-making, creating plans, and of course, answering any questions that you may have as a patient with kidney disease, a caregiver or a family member of somebody that has kidney challenges, and to help navigate for any healthcare professionals that might join us as well today. So thank you for everyone who came. So let's kind of get into it. What is conservative kidney care? So conservative kidney care is a treatment approach for people with advanced kidney disease that does not involve dialysis and it does not involve kidney transplantation. So people that have chosen conservative would not receive a kidney from somebody else that donated. The focus then really becomes symptom management. We still want to protect as much kidney function as we can. And so we do still monitor things like blood pressures, blood sugars for diabetics. We still do blood work as necessary and make any medication changes. But again, really the focus is on symptom management. We work at our clinic with patients that are living in the community. So that could mean that they live in their own homes or they could live in a continuing care facility. And another part of our job is supporting those other community partnerships. So working with family physicians, pharmacists, community paramedics, home care, facilities. And then, of course, as needed, we'll work with the palliative team to really help support patients and their families in the community and in their own homes as much as possible. So I'll shift to the next slide here. So who would choose conservative care, or why would somebody choose conservative care is a question that has come up. And I think that's why the Kidney Foundation has asked us to speak a bit about conservative care, because it's a topic that we'd love to get more information out to everyone about. So people will choose conservative kidney care for different reasons. Many patients that we deal with have chosen conservative care because they have multiple other health conditions or challenges that dialysis won't fix or improve their symptoms. An example of this we often see is somebody that might have end-stage heart disease or heart failure. Dialysis is not going to improve those symptoms or improve their quality of life. And so often patients will decide to not pursue dialysis or transplant for that reason. There's different types of dialysis as well, and both of them have challenges that we really want to go over with individual patients. An example is there is home dialysis, and people may choose conservative care over that because they may not have the supports or the space needs that are needed for that type of dialysis. They might not have the functional ability, so they might have, mobility issues with their hands that would make it difficult or not possible for them to do that type of dialysis at home. There's another type of dialysis called in-center, so going to a facility that is often 3 times a week for multiple hours. And so, as you can imagine, that takes people away from their homes and from their loved ones for long periods of time. And the other thing is, dialysis doesn't always make people feel better, especially if they have other health conditions. And the side effects of the dialysis and the coordination of organizing dialysis may be burdensome and actually might outweigh the benefits for that patient. And they may decide that that's not improving their quality of life and that's not something that they want to pursue at this time. Who do we offer conservative care to? Everybody. So we're very lucky here at our clinic. We have an education class talking about the different types of dialysis, conservative care, and transplantation if applicable. And we offer that education to all of our patients. That way, we can go through all of the options, kind of determine any challenges for any of the options and help patients make the best informed decision for what would be best for them and their health journey. So we do offer it to all of our kidney patients, okay? One of the resources we're going to talk about on the next slide here is called the ckmcare.com website. And we're going to go into that website in a minute here. And what this is a website that we use at our clinic ourselves, but also one that we provide to community members. So family physicians, continuing care facilities, and to patients with all kidney function. And what this resource is really talking about conservative care, decision making, and then going over some symptom management so that patients can feel like they have an opportunity to know what the future looks like with kidney disease and what they can do to help support themselves at home in their own community. So if we could, we're just going to load that website here for you, and we're going to go over some of the information that's available. So this is the website here. I hope you all can see it. It's the ckmcare.com website, as you can see here. And it breaks it down into a few different tabs here: patients, decision aid, and health professionals. We're going to go into decision aid in a few minutes here, but what I really encourage any of you joining us today is using this website. I want you to feel very comfortable that you can go both in this patient family area as well as healthcare provider. And what it's going to do is just give more information for you as a patient, but also your healthcare providers, so that you feel a bit more supported making these decisions and knowing kind of what conservative care can offer you. So I'm going to go into this patient family tab here and show you. So this is going to go over that decision aid, which we'll go through together in a minute, knowing about kidney disease and symptoms in general, and then talking about kind of advanced care planning and plans for the future. So I'm going to click into here, into symptoms. There's lots of resources here that you can see, booklets that you can email to yourself, you can print, as well as looking at kidney conservative care. And then some pathways here as well, which we're going to go through together. So one thing I think a lot of people in their homes and in community are worried about is, symptoms of kidney disease and what do I do if I start having some of these concerns? And so this is a good resource. I'm going to go over itchiness as an example. So itchiness is a common side effect or a common concern we see with end-stage kidney disease. And this resource will give you some options on what you could try at home. It's going to give you non-medication options, so non-pharmacological, and then it's also going to give us some suggestions, and your family doctors and your kidney doctors some recommendations about medication treatments if needed, okay? And there's some handouts here as well that you can print. So this will give just some examples of simple things you can do at home to maybe really help those symptoms. So keeping your house cool, making sure you're using lightweight clothing, non-fragrances, moisturizing, right, as soon as you get out of the shower, right? And then it's going to talk to you about if those things aren't helping you, what could you do next? So talking to your care providers at this point might be a good suggestion. And then as a care professional, the part of my role is to help give evidence-based benefits, like something that might be more beneficial that might need a bit of medication. And so again, we'll use itchiness as an example. We call it uremic pruritus, but it means itchiness, okay? And so the same suggestions that were given to patients that are non-medication based are going to be here. Again, bathing better than showering, wearing cool clothing. But then a nice thing is it's going to give us the next option. So topical cream, so a lotion. These are all things that patients can talk to their pharmacist about, their family doctor about, and trialing that. And then if that was to not work, then it's going to give us some better options for medication, an example being gabapentin. Part of our role here at the conservative caseload is doing the follow-ups with the patients, seeing what they've tried, and then going from there, doing the follow-ups after we start medications. So that's a little bit of part of our role, Ruth and I, here is to help case manage these patients and their families and help them feel best supported in the community. Okay. So when we talk about conservative care, I think that always a big decision is how do I make that decision? What do I need to consider in my own life that might make me choose dialysis or conservative care? And so this website has a decision aid that can really help kind of give you some focus on what you value and which way it would suggest. We'll run through a case scenario here quickly, and hopefully that will make you feel a bit more comfortable to do this on your own time. So again, I just went into the patient decision aid. Okay, it's going to have some pop-ups, give you some things to think about. Okay. This is a good way to learn about conservative care as well as dialysis. So what would it look like if I chose conservative care versus dialysis? Okay, there's some really good videos here as well. And there is also, sorry, I wanted to show this up, some great photos to show you what that would look like if you were to choose dialysis, okay? So I encourage you to continue to click on those and get some other information, okay? So what we're going to do is go through a quick case study. So an example of a patient that we might get at the conservative caseload that's questioning, would they want dialysis or conservative care, okay? I do want to also make an acknowledgement here that this decision aid can be done at any kidney function, but a lot of the pop-ups that we're going to see here in a second are really based on patients who have a low kidney function. So that's usually a GFR or a kidney function of less than 15 out of 100, okay? So we'll talk about that as we go, okay? So my case study is a 75-year-old woman who lives independently but needs some help in her home. She has other medical conditions such as diabetes, high blood pressure, arthritis, vision loss, and then she has her chronic kidney disease. Big values for her is not going to hospital and also wanting control over her own time and her own schedule. Okay. So we'll go through this together. So as if I was my 75-year-old patient, right? I live in a house, I said. So does she live in a nursing home? No. Okay. Does she have any cognitive impairments? No. We said she was 75. Okay. So this is a pop-up that's going to tell us that as patients become more senior in their age, that's going to adjust. We have to acknowledge that there's often other medical conditions that can come with life expectancy. And so her total life expectancy, just based on the fact that at this point she has very low kidney function and her age of being older than 70, this is going to split. So conservative care and then hemodialysis here. Okay. So it says that her life expectancy is 14 months if she were to choose no dialysis. And over here, 34 months if she were to choose dialysis. But a big thing to notice here is she's going to spend 14 months of that time at dialysis, traveling to her appointments, following up with her kidney team. Okay. The next thing is we said that she, she's quite independent, but she does need a little bit of assistance. And this is just saying that we know the patients that do best with dialysis treatments are going to be independent. That being said, we're still definitely able to set up things like home care to help assist with that. We said that she did have other health conditions, but we didn't say anything about heart disease, okay? So then this is going to tell us that the more health conditions someone has, of course, um, the more challenges dialysis will bring. Okay. And this is showing you that with or without dialysis, it's pretty much 50-50 that this patient is going to live 1 year. Okay. So then we need to really acknowledge the challenges of dialysis and would that be something someone would like to pursue? Okay. We said that this patient would like to avoid hospital. So that's very important to her. And then major or minor surgery, let's say maybe 4, because of course we acknowledge other things that might need surgery that might not be a major surgery would be something she would be interested in. Let's say she fell and broke her arm as an example. That might be something she would still want surgery for because that's going to improve her quality of life. Okay. And then how important is it for you to avoid traveling for dialysis? We said that this patient really values her time and her own schedule. So let's say maybe a 4 and a 5 for her time. Okay. This is just an additional consideration. So things that you might, as you go through this process, want to talk to your medical team about, your other specialists, your kidney doctor. You feel free to write any information down, any things you'd like to maybe look more into. And then at the end, you're able to email it to yourself. Okay. So we'll skip this for today, any additional one. Okay. And then how this works is it's going to go over each of those questions that you answered that's very personal to you. Where would you be on the conservative or dialysis side? Okay. And so we could say, we said symptom management wise, she's sitting more in the conservative management part than dialysis. Okay. The control of her time was very important. And so a conservative might be a better option for her than the dialysis treatments. And again, hospitalization is she wanted to avoid hospitalization. So that's a more conservative than dialysis opportunity. Okay. In the end, you can, email or print it for yourself. There's no black and white answer, unfortunately. It is a bit of a conversation. This resource is really to give you opportunities to think about what would be best for you individually, as well as what you value and how we can help support that value. It's important to talk, of course, to your family, your other health teams, about your wishes, have answers, write down questions that you might have so they can provide some answers to you. And then once somebody chooses conservative care, at our clinic, we would take over as a team. We continue to follow these patients, make adjustments, and we're really here to help support you in that choice in your family and to help plan for the future and what that would look like. Okay. We then would ask palliative to become a part of our team as well to make sure that symptoms are well managed in the community and setting up what the future would look like with their support. Okay. The next part of our conversation today is really about that communication with our family members and our teams and planning for the future for any big medical decision, not just this dialysis or conservative, but any major medical condition and decision. This is a good opportunity to have the discussion. So I'm going to pass the floor over to my colleague Ruth here, and she'll take over for now.
Good morning. Advanced care planning is a really global term we use for people making choices and plans well in advance of needing them. And that can be from things you think about to things you legally go ahead and put into writing. And it starts for anyone, like at a young age, when you're doing your driver's license, they might ask if you want to be an organ donor. And that's part of advanced care planning. And if you have many health concerns and you land in a hospital, they may ask you things about a goal of care or a resuscitation status, meaning with all the health concerns you have? Would you wish to have your heart restarted, or would you go to an intensive care unit? So these are the things that are all part of advanced care planning. The most important thing we want is for you to be able to advocate for yourself, but also empower others. I think I'm still on the advanced care planning side, Carrie. And be able to tell people what your wishes are. The last step of that would be able to do a legal plan. So the national website, which was on the original slide, is what we're going to go into here. I'm going to share that with you. This is a national website, and it's designed for, just like the last website, it's a tool. It's a tool for all of you to use and have, and there's videos, again, there's resources, and it's meant to give you places to start when you have those conversations around what your future health could look like and the decisions you may make, just such as conservative care, but also who and why you would want have as your ADM, alternative decision maker, or in some places it's called SDM, substitute decision maker. And I'd like to point out this ACP across Canada because this is a national webinar. This is a really great resource because you can see the map of Canada here. And if you choose on any of these provinces or territories, it will come up with the resources available to you in your own province. So here in Alberta, where we are, this would show the resources we have for advanced care planning and goals of care discussion, with many links that you can use, and they tie to videos. And so that's a great spot for someone to start the conversation, thinking about it for themselves, doing it in your own home where you're most comfortable. So, we really would like people to utilize these resources as something they can do for themselves, but then engage those who need to be part of the conversation. So if you have questions around your health, you talk with your primary care providers, your family, your specialists, and they're going to help you understand your health conditions and how that might apply to your decision making. Similar, Ontario has many resources. Quebec will have its own resources. So I think this is a great space for people to go to and understand what's available to them, because this kind of legal documentation, when you get to that point, is really very much territorially and provincially guided. Your documents can be recognized across the Canada when you have them completed. So if you're traveling, but they always should be pretty much written for the territory or province where you live. So here we call it a personal directive. It might be a power of attorney for health in British Columbia, or in Ontario. In British Columbia, it's still called a living will. So these are the things that people really should be exploring and understanding for themselves as part of their general health planning. So not only are you making choices about treatment, but you're also making bigger choices about things such as if you temporarily lost your ability to speak for yourself. Who would you want as an advocate? And I always really encourage you to think about who could best speak for you, but then also include the rest of the family and all of your loved ones in those conversations, because if a crisis hits, you really want people to work together and not be arguing amongst each other. I don't know why they picked you. You aren't the right person. But if they know in advance why they picked you, they can say, let's help them support our family member in this crisis. So that's really the intention of advanced care planning. And it's I think it's something we all understand we need to do, but really only 30% of people ever really progress to getting all their legal affairs and their conversations in order. So something that's on our checklist, but sometimes we really avoid. So I'm going to stop the share there. and go back to our presentation. So that's the website. The next slide tells you about the steps. So think about your values, your goals, especially any experiences you may have had with people you know or your own loved ones. Because every time we've had a personal experience with health challenges or crises, we learn from it. We say, I don't want what happened to Aunt Mary to happen to me. I would much prefer to make this choice. So those things are very much personal experiences that will guide how you want your own health to unfold. And, you know, learning about your health, ask those questions of your health providers, your specialists. If you don't understand how things are going for you, or if there's new information that comes up, really ask them, what does this mean? And what kind of choices do I have? When you choose an alternative decision maker, again, it can be anyone from your partner to family to friends to an adult child. I just, again, really want to emphasize making sure all those in your life know who you've chosen and why, so they can all support each other if there's ever a need in a crisis situation. And then telling loved ones, doctors, family, what your wishes are. And if your wishes change, letting them know as well, because everyone working together gives everyone the most support we can have. The last step is writing your documents. So those can be done often with a lawyer. They often do all 3 documents people need, which is an enduring power of attorney, a personal directive and or power of attorney for health or living will, and then your will. They'll often do the 3 documents people need together, and those are all to manage different things. We only use a will, unfortunately, after someone is passed, a power of attorney for financial matters, and then the other document, your personal directive or power of attorney for health or living will, for when decisions around health or non-financial things have to be made when you are not able. And this can be a temporary situation or a more permanent one. So temporary, you may have a sudden illness where you end up losing your ability to talk in an intensive care setting, but regain it. But more permanently, people can have long-term things such as dementia that comes on maybe slowly or sometimes suddenly, but results in someone long-term needing to step in as your decision maker. And it's always better if these documents are there in advance, because then those can be actioned on immediately, versus if they're not there, family and friends would have to petition courts to become your guardian and or your enduring your power of attorney, and that takes a lot of time, energy, and unfortunately money to get that in order. So the advanced part of advanced care planning is really the key there, having things done in advance. So we'll go to the next slide. And this is what's most important with all of it. So with everything you think about, from being a conservative care patient to a dialysis patient, if that's your choice, even having these conversations, communication is the key. We want you to talk with us, with your family, with your partners, have everyone on the same page so all of us can work together to support you in your choices and wishes as you journey through your kidney disease. And I think that's really the most important thing. So we're going to leave it. I think we get to hear from Dr. Zhao soon.
So thank you very much to Ruth and Jennifer for the insightful look at conservative kidney care. And thank you to both of you for the insightful look at conservative kidney care and advanced care planning, and for walking us through these extremely helpful resources. I'd now like to introduce you to Reverend Dr. John Matwawana, who is going to share his personal journey with kidney disease and with choosing conservative kidney management. Reverend Matwawana is a retired pastor, chaplain, and missionary. He was active as a consultant for the Canadian Baptist Ministries in the area of peace and reconciliation with Foreign Affairs Canada, and in the UN-sponsored peace talks in Burundi in 2002. John has been awarded 2 Doctor of Divinity degrees, the first one from McMaster University and the second from Acadia University, in recognition for his work in peace and reconciliation in Canada and in Africa. In 2006, the president of Burundi, Pierre Nkurunziza, cited him with appreciation for his contribution to peace in that country. In 2007, John and his wife, Nora, received the first Denton and Janice Lotz Human Rights Award of the Baptist World Alliance. John was diagnosed with chronic kidney disease in 2022 and has opted for conservative kidney care.
So first of all, I would like to say that my background in the medical sector is being a minister in my early ministry as a chaplain and as a hospital chaplain for 80 years, where I was able to counsel patients and discuss matters with medical staff. And through that experience, I learned a lot the struggle of many, many patients from different kind of sicknesses. And those patients sometimes struggled to make decisions because of their background and the circumstances. And those times were very difficult for some. As a chaplain, I had to give some kind of help and assistance in making those decisions with their families and friends. So when I came to Canada, I was a chaplain, but this time not a hospital chaplain. I was a prison chaplain. But at the same time, I was also confronted with some health problems in my family. And then later I developed blood pressure problems, which went on for many years. So my concern was always for my blood pressure for all those years. Later I knew that the medication I was taking for my blood pressure also was affecting my kidneys. Although my doctor, like some of the doctors, warned me that you may be having a problem with your kidneys in the future. But I was not concerned because I didn't understand the seriousness of that disease. I was just warned that I may have trouble. So until when in 2002, in June of 2002, when I had a heart attack, then everything came out and they said that my kidneys were worsening and many things have to change when you get out from the hospital. So from the hospital, I got really the bad news that you have to make a lot of decisions because your situation means you can't even take care of your house anymore. You have to be in a place where you have one level and you have to be careful what you do, what you carry, so because anything can happen. So at the beginning, it was a little bit scary because I was still in the hospital struggling with my heart problems. And at the same time, I was not good on my eyes, and I was not good on my prostate cancer. So when you have issues, medical issues, and then having something which come with that kind of warning, you get a little bit out of place. You lose a little bit the control. But I said, okay, I will see. Discharge me first, I go home, and then I relax, and then I start thinking about that. So when I was discharged from the hospital, I went back to the specialist, the kidney specialist again. So I was told that the situation of my disease. And then I was also told about the possibility of all of the option of free kind of treatments. And they told me that you have to read this book and make a decision yourself after you consult your family and the loved ones. So I read the book and I read all the implications. I came to the conclusion that in my situation, with other medical situations I have, and also with some other family plans I had, my best treatment, my best choice was the conservative management treatment. And of course, I discussed it with my wife, my children, my friends, my relatives, and then I went back to my healthcare team. The reason being because I felt that with the conservative management treatment, I still have a chance to do more things with my family and also be active in some of the things which I always did in my community and church without interruption. So that's what I did. And that first year, I was able to travel to US and to attend my grandson's wedding. And also I was able to keep my church activities, my community activities, and etc. But above all, I'm happy to see that I can manage to do more things, although there were so many other surgeries. Like I had the eye surgery, which failed, and then as a result, I lost my left eye sight. So as a result, I can't drive anymore, and that's frustrating. But still, with one eye and with some strength in my body, I'm still do better. And I feel that the choice I made was the best because I still do things which I wanted to do. And also, as Ruth mentioned about the advanced planning, advanced care planning, that also was considered, and I was able to prepare my document, my living will, which was given to my lawyer and my family doctor and all the members of my family. So this is my situation, and I feel that decision I made was a good decision in my situation, and I don't mind recommending it to my friends and family according to their situations.
Thank you so much, John, for generously sharing your story and your experiences with us. I think now we'll move forward to some of the questions that we've seen in the Q&A and that people have reached out to us with.
So,
and the first question is really for John.
yes.
Is there anything in the experiences that you've had that you wish your loved ones understood a little better in terms of making the choice that you've made?
Yeah, I think my family was very concerned because they thought I was going to die in 2 weeks, and there was no clarification how long I can live. That that information was so important, because I just said to them that I was told that I will not live long anymore. And then they said, how long? I said, I don't know. So that was not good for them, because everybody was so scared that we are losing dad, we are losing uncle very soon, which was not true. I don't know how that could be explained.
Thank you very much. The next question is actually for Ruth and for Jennifer. One of the questions that we hear a lot at the foundation is, can I change my mind if I choose conservative kidney management?
Definitely. It's always a person's prerogative as they are journeying on their health and kidney journeys that you can change your mind and choose dialysis at any point, or stop a treatment at any point. So we highly support that. And I always say to patients, and maybe this will help Reverend John a bit, is, none of us have a crystal ball or a magic wand. We can't always predict end of life or people's lifetime trajectories, but we can only do our best. And all of this work we do and the conversations we have help people make those choices.
Thank you both. We do have a follow-up question from the Q&A, and it's a question for Ruth and Jennifer again. Do you think that in conservative kidney management, an option of less dialysis than the usual frequency per week, the number of minutes per week, should be offered?
Yeah, that's a really good question. It is something that the kidney doctors here, the nephrologists, do sometimes set up for patients. We don't follow those patients specifically under the conservative caseload, but it is something that is definitely more information, more research has been going into. And so it is an option, but just not under our conservative caseload at this time.
But it is something some of the more senior patients we see do. We call it incremental dialysis. And it's a little, for people who don't need to clear as many toxins, but might have minor fluid issues or just, have physical constraints. It's something that they do try more often. So again, it's another part of the dialysis options, and people can try it. And if it doesn't work, again, choose to stop if it's not supporting the quality of life or the type of life they expect at the stage they're at.
And next question is for John. What is it that you're doing that helps you to maintain your quality of life? Is there anything in particular that you would recommend? Just asking what it is that you're doing individually that is helping to maintain your quality of life, and whether you have recommendations for our participants today about that.
Yes, I think one of the ways I approached it, I didn't cancel the plans I had. Because I said, okay, I believe that I can make it. If I don't make it, that's okay. But I just try to be on a positive side, to say, I will not cancel anything. I just go one day at a time. And then I go from there. So, so I think having a positive mind is important. When you are in a disease where you have a kind of uncertain situation. So I'm always positive to say that, okay, I live one day at a time, but I don't cancel my plans either. And as a result, when that day comes, I do it. I'm still alive. And I always tell people that don't look in a negative side. Look in a positive side, because you may live longer than you think.
That's great advice for all of us. Thank you. Next question for Jennifer and Ruth. How often should people be visiting their nephrologists or their nurses or the rest of their healthcare team during the course of their conservative kidney management? Is this something that is happening regularly? Are they being managed individually in the team, and by whom?
Yeah, good question. Every person is a bit different in how we manage them and what their needs are. We're very lucky that we have opportunities to do a lot of follow-ups over the telephone, over Zoom for video conferencing. But we do have, of course, the ability to bring patients in person as well, if that works best for them. It is quite individualized, to be honest, and what the needs are. But we're here to help support as much or as little kind of kidney care as needed for each person.
Thank you very much. At this stage, we are at the end of our webinar. We would like to thank Ruth, Jennifer, and John for the informative and inspiring session. The Kidney Foundation is committed to providing information and educational resources about kidneys and kidney disease. And through our regional branch offices, we offer advice and support about accessing services within the healthcare system and support in your community. So we invite you to contact us if you have further questions. If you have questions from today's webinar that haven't been addressed, feel free to reach out to kidneyprograms@kidney.ca, and we'll make sure that they're answered, and we will reach out to our panelists today. On behalf of the Kidney Foundation of Canada, thank you for attending today's webinar, and have a wonderful day.